What did they find? At the end of this 10 to 15 year follow-up study of this 174 people, 54% did not have pain, 46% had pain. So again, almost a coin flip. And the average number of treatments in this group was 3.8, meaning almost 4 separate different types of treatments. And they were all of those standard treatments that we already talked about. So 10 years, let's say average, because it was 10 to 15 or so, 10-year follow-up, standard treatments, coin flip, whether you still had pain or not. That is astounding. That is what I meant by interesting findings. So the risk of having plantar fasciitis in this study, after 1 year, 80% will still have plantar fasciitis. This is after your diagnosis. After 5 years, again, coin flip, half are gonna have pain. After 10 years, 45% will still have the pain. And after 15 years, 44% will still have pain. This is with treatment, up to 4 different treatments. So the long-term outcomes of this problem with the current treatment regimen is not that great, which tells me either they're not diagnosed properly or the treatments aren't that great. The risk of ongoing recurrent pain was higher if you're a woman. We don't really know why, and it's higher if the pain was in both feet. And I think that's because usually if it's both feet, the problem's really the nerve, inflammatory arthritis, something like that. Usually it's not a mechanical, quote unquote, overload and wear and tear in the same way in both feet. So bilateral to me is usually a harbinger of maybe there's a different diagnosis. Being a woman puts you at risk of more pain, but effectively, even if you have 4 different treatments, which I already told you what that's gonna cost you and the time involved, you really can flip a coin if you're gonna have pain at 10 years or not.